Hello, everyone, and good evening. On behalf of Cuyahoga County Public Library and Cleveland Clinic Community Care, I wanted to welcome you to tonight's program, COVID-19 Vaccines, What's Next for Your Teen and Child. I'm Emily Gieler from the Brecksville branch. Thank you for joining us for this important conversation. Today's panelists are Dr. Roopa Takur, Gina Robinson, Dr. Kyle Mudd, and Dr. Alice McIntyre. So I'm going to hand it over to Roopa now.
Hi, thank you all for joining today. My name is Roopa Takur. I am a general pediatrician at the Independence Family Health Center and medical director for Cleveland Clinic's school-based health program. I'm so pleased to be here today because I know that you all have many questions about vaccinating our children against COVID-19. And I have an all-star panel of pediatricians here with me to help address them. So maybe we'll start with you, Dr. Robinson. If you could tell us a little bit about yourself, and then maybe tell us a little bit about how effective vaccines are in preventing COVID-19 disease as well as spread.
Good evening, everyone. I'd like to thank the library for inviting me to be a part of this. I'm really happy to share information with the community and answer questions. And I am Gina Robinson. I'm a native Clevelander, a general pediatrician in the Mayfield Village office of the Cleveland Clinic. And I've been practicing for 23 years. So it seems like only 23 months sometimes, but it's been a while. And I think one of the biggest things I've seen over the span of my career, when I think about what advance in medication in medicine has made the biggest difference, it's been the development of vaccines. And I see diseases, or there were diseases that I would see, or infections that I would see when I was a resident or when I was in medical school, things that I learned a lot about, but I don't see them very often anymore because of vaccines. So it's really exciting. Sometimes when we think about medicine and advancements, they're so abstract and they're hard to relate to, but when you see something happening in your career, it makes it just that much more impactful. And when I think about COVID, we're all living through a pandemic for the first time. So a lot of these things that we're learning about COVID are happening in real time. So that can be frustrating. And we want answers because we're so used to having answers for how we treat infections and how we vaccinate, but we're learning a lot of these things. And that leads me to your question about efficacy, because that is something that's an ongoing question. We're studying it, we're looking into it. There are several studies that are going on, and there are different factors that make a difference in how efficacious the vaccine is. The population that you're looking at, what kind of risk factors and other conditions they might have, the ages of the different populations. So there are a lot of things that we don't have answers to, but what we do know is that the vaccines that are available now are very, very effective, especially in preventing the very bad and scary outcomes that we can sometimes see with COVID disease. So the hospitalizations are definitely impacted in a positive way. We see lower numbers of hospitalizations. We see lower numbers of complications. We definitely are seeing that as the rates are higher in certain communities, you're noticing that the people who are getting sick are the people who haven't been vaccinated. So that is one way for us to kind of see in real time as we're waiting for those final answers and numbers that this is actually working.
Absolutely, I agree 100%. Dr. Mudd, again, if you could tell us a little bit about yourself and then maybe tell us what we've learned about COVID vaccine from a global perspective. What have we learned from the vaccination efforts of other countries?
Certainly, thanks, Dr. Takur, and thank you to the Cuyahoga County Library for hosting this opportunity for us to give some information tonight. But my name's Kyle Mudd. I'm a pediatrician in Fairlawn, Ohio. I practiced previously in Medina, but have been with Cleveland Clinic since the beginning of my practice a few years back. I'm at the other end of the spectrum. So many times in residency and training, we would not have the opportunity that Dr. Robinson had to see some of those diseases, and thankfully for that. That's a testament to the successful the success of vaccinations. I have had the opportunity to go overseas on medical mission trips, however, and see some of those diseases across seas. And that is one thing that I remember very vividly. One of the medical or one of the physicians telling me was that, you know, I can be here for the next 5 years, but that refrigerator of vaccinations is going to be keeping this community healthy for the next 40 to 50 years. And that really kind of stuck with me, along with seeing some of those illnesses that we just don't see any longer in our country because of the success of vaccines. Right now, in terms of what we are learning from a global perspective with COVID, is that there is a large inequity of vaccines spread among the countries of the world. Right now, we're lucky enough to be in a country that has a surplus of vaccinations, or vaccines, and that is why we're able to help with sending some overseas to other countries that do not have as good of a supply chain as we do. But we are seeing globally that there is a clear correlation with vaccine rates and the disease burden of COVID. Israel, for example, was one of the first countries to show in a study that they were able to drive the COVID burden down with a very, very high vaccination rate. The same can be said in the UK as well. And those are big takeaways, I think, that we can learn from the global community. We've also seen a recent uptick in COVID cases across the globe, however, over the last 2 weeks. And part of that has been elevation or lifting of the restrictions and mask wearing. And so I think that is another thing we need to take away, is that even though we do have vaccines here, thankfully now in July of 2021, that we can't take our foot off of the pedal in terms of the other behavioral components to prevent the spread of COVID.
Absolutely. Now I know Dr. McIntyre has been having a little bit of technical difficulties. Are you there, Dr. McIntyre? Just in time.
Hi.
Hi there. So we were just hoping that you could tell us a little bit about yourself and maybe answer the question about when vaccines might be available for younger children, what the risk might be for them until they get their vaccine, and what precautions they should take.
Sure. So I am a general pediatrician with the clinic, Avon Point, and I've been here 14 years in my current practice. And I would be happy to help answer that question. So in terms of when vaccines might be available for children under 12 years of age, experts expect that the vaccines could be available sometime this fall to winter. We don't have definitive data yet. There are clinical trials that are underway to evaluate the safety and efficacy for younger kids. And as you know, Pfizer is conducting clinical trials for 3 age groups: 6 months to 2 years, 2 to 5 years, and then 6 years to 11 years. And then Moderna is also conducting clinical trials. Johnson & Johnson and some of the other companies are doing clinical trials for older children, 12 and older. So at this point, we don't have a definitive time set, but the expectation based on experts is sometime this fall to winter.
Great. Now I know that there have been a lot of questions from our audience around vaccine safety. So I was hoping that we could address that next. Dr. Robinson, could you tell us a little bit about overall safety and possible long-term effects of the COVID vaccine? and how safe the available vaccines are.
I would love to. What we know so far, again, remembering that this is all happening in real time, is that the vaccines that are available are safe. We do see some side effects, and they tend to be similar to the side effects we see with other vaccines. Dizziness, some fainting are probably the most common side effects that we see with the COVID vaccine. And that's not dissimilar to what we might see with other vaccines, especially in adolescent patients. There are some cases of myocarditis, which is an inflammation of the heart that have been seen in association with the second dose of the vaccine, but that's a very limited group. And there's a recent quote of 12.6 cases out of 1 million second doses occurring within 21 days after vaccination. So when you think of 12.6 out of 1 million, that's a very low number. And it's really something that we're studying and looking into what other risk factors might put someone in that group where they might be a little bit more concerned about developing that complication. The good news about that is that in some studies, as many as 95% of those patients have recovered fully. Most of this is a self-limited kind of thing. And myocarditis is something that we've seen in other, association with other diseases, actual infections. So it's not something that we're not unable to treat and that we're unprepared to face if it does happen in those rare instances when it would occur. It's hard, I think, I love the internet, but there's a lot of information out there. And it sometimes is difficult to filter information and decide what is reputable information, what's good information, what's bad information. So I think it's always best not just to Google topics, but to go to an expert. If I'm looking for, even hair care, I'm going to go to an expert. So if I'm looking for information about infectious disease, I'm going to go to the CDC. I'm going to go to the people who are experts so that I make sure that the information I get is vetted and it is the information that's going to help me make the best decision and the most informed decision that I can make.
Absolutely. Always looking for evidence-based, data-driven information, right? Dr. McIntyre, could you tell us a little bit about how vaccine injuries or side effects are tracked and how we report them for our patients?
No, absolutely. So in terms of vaccines, and as pediatricians, we are well versed in tracking vaccine related events. And so our pediatric office, as well as all Cleveland Clinic pediatrics office, have a process in place to report any possible vaccine reaction to VAERS. VAERS stands for Vaccine Adverse Event Reporting System. And it was established in 1990. It's a national early warning system to detect possible safety concerns or problems in US licensed vaccines. So we do report to VAERS for all our vaccines, including the COVID vaccine now. And that is how we would track.
Great, thank you. And Dr. Mudd, can you tell us, our parents have heard that there have been thousands of deaths due to the vaccine that were reported to VAERS. Is there any legitimacy to this? What thoughts do you have on that data?
Sure. So I think it is very important, again, to look at the context of the information. The concern for the deaths reported to VAERS was generated by looking at the number of deaths following COVID vaccinations. It's important to know that these numbers are reported no matter what, no matter if the reporter thinks that the death is associated or caused by the vaccine, or if it's just, we randomly had this event that occurred after vaccination. It's very important to remember that association doesn't mean causation, and a number of people just by way of natural selection are going to have are going to pass away after receiving an immunization. The CDC physicians looked at the data. They reviewed all of the individual reported deaths, and they concluded that there's no there's no merit to the report that COVID causes deaths after receiving the COVID vaccine. And they really, the VAERS system is very, very effective. It is how we were able to detect that there is a small increased risk of blood clot formation with the Johnson & Johnson vaccination. Was discovered through the VAERS, but it is a part of the system that we are naturally going to have, because there are natural deaths in the community, and they are going to be reported no matter what through the VAERS system, regardless of what caused those deaths.
Right. Any final thoughts on vaccine safety from the team? No. All right. We did receive some questions around some special considerations. So Dr. Robinson, I thought maybe you could talk a little bit about children with asthma, what risks they might have if they were to get COVID infection, and how important the vaccine might be for them.
Sure. Asthma is one of the things that we see a lot of in childhood. It's one of the things that we focus on trying to treat and do preventative care. So of course, we're going to be concerned with how certain diseases can affect our patients with asthma. And initially, asthma was on the list of conditions that would make one high risk. But as time progressed, it kind of got lower on that list, thankfully. I would recommend, though, that every child who's eligible at age 12 and up now receive the COVID vaccine. I would be a little bit more concerned about complications, pulmonary complications or lung complications in kids who have asthma. But in general, kids, we just want everyone to be vaccinated. I said that in a very clunky way, but I hope I made my point.
Absolutely. Another consideration, so as the world is kind of reopening, we talked a little bit earlier about how masking policies are being reduced. A lot of the restrictions that we had last year have been relaxed. For families that are considering international travel to a country where less than 1%, let's say, are vaccinated, or low numbers are vaccinated, what precautions should they take? What thoughts do you have about that? So I'll direct this to Dr. Mudd, but if any of the rest of the panelists have thoughts, please feel free to chime in.
Sure. So the CDC is currently recommending that travelers try to avoid areas that have that high of an incidence of COVID. So they have 4 different levels, and if we are in that level 4 area with the COVID burden, they would recommend that you try to avoid that area regardless. However, if traveling, they would certainly recommend that we're fully vaccinated before we travel to that area. There's an excellent website that they have for travel health that looks at each country in particular, their current COVID burden, as well as the vaccination rates, and then the guidance in terms of what they would recommend if we're vaccinated versus unvaccinated. Certainly masking is recommended, especially on flight, but also if we're going to be in a close enclosed situations indoors. They also recommend for certain countries that we would receive testing 3 days before we go to said country, and that would depend on our vaccination status as well. But I would definitely encourage anyone considering travel right now to any of these areas to go to the cdc.gov/travel homepage and seek out more information there.
Great. And then thinking more locally, there are questions around what to expect for the fall as schools reopen, whether Ohio is planning to require masks for students in school, or if they're leaving it up to individual districts and schools. So Dr. McIntyre, I'll ask you your thoughts on this, and I can add a little bit from my experience in school-based health as well.
Okay. So Ohio, as you know, Ohio lifted its COVID-19 related health orders on June 2nd, which ultimately leaves the operational decisions to the local school districts in terms of masking requirements. At this point, also, I think it was sometime in the beginning of July, the CDC had also had recommended that, or had said that it was fine for fully vaccinated teachers and staff not to wear masks. So this is an evolving process. I think as the fall approaches, we have to look at the vaccination rates, the COVID rates, the Delta variants, in terms of whether or not there will be masking for the schools in the fall. Some of the biggest questions would be at the middle school level, where some students are eligible to receive the vaccines, COVID vaccine, and some that are not. And at this point, based on the age of 12 and older, there's going to be, kids are going to be partially vaccinated. So administrators, school administrators are going to be making that decision. So I think the guidance is really written for the local level or districts to decide. I do know that in some of the nation's largest school districts, they are recommending widespread masking to continue into this fall. So I think in Ohio, the information that's going to be coming in over the next probably month to 2 months will help determine whether or not masking is going to be required.
Absolutely. And what we're hearing from our districts that we serve with the school-based health program is that many of them are waiting until the end of July to kind of help inform their decisions, see what the current status is at that point before they determine whether they're going to require masks or not. So it seems like it is, as Dr. McIntyre said, very much up to the individual districts, but the Ohio Department of Education always puts out guidelines or recommendations for infection prevention. Now, Dr. McIntyre, you touched on a couple of these things, so I'll pose these questions to the group. Could we talk a little bit about how to keep children under 12 safe until they're eligible for the vaccine?
Go ahead. We're all just chomping at the bit for that one. I like to think of the Swiss cheese model of preventing COVID spread. So if I have a slice of Swiss cheese by itself, there are all the holes that something can get through. But when you stack the cheese up and make a really good, tasty sandwich, you're helping to reduce the risk of spread. So think of those layers. Vaccine is just one slice of cheese. Wearing a mask yourself is another slice. Someone else wearing a mask is another slice. Social distancing is another slice. Limiting the size of gatherings is another slice. So I think the best way to keep everyone safe is to remember to add those layers and not just rely on one thing, and then to just be vigilant and not give up too easily and say, okay, we're done with that. I've got COVID fatigue. I'm ready to take the mask off and go back to life as it was, because if we do that too soon, then we end up going back in the other direction.
Great, I love that Swiss cheese model. Any other thoughts on that one?
Like we were talking about, and like Dr. Robinson had mentioned, some of the, one important layer of that, one important piece of cheese is the masking and physical distancing. So Dr. Paul Offit, when they were asking a lot, he's one of the premier infectious disease doctors of our generation, helped come up with the rotavirus vaccine out of Philadelphia. When they asked him, he said he would, over the vaccine any day, take social distancing and masking, because it's a certain way of preventing infection, and especially for children and those in that vulnerable population. That's the best thing that we can do. And I think as parents, we can try to model for children. We might not have to wear the mask, but I have a 2-year-old son, and it doesn't make much sense to try and have our children wear masks without trying to set that model for them in the community. So that's one thing that I am encouraging my parents to do if we're expecting that for our young children, is to set a good example for them, you know, whether or not we're vaccinated or not.
Great.
And I agree also with Dr. Mudd. Thank you for letting me jump in. Wearing a mask in solidarity with your children, I think is really important, setting that example, showing them that even if you're vaccinated, that the parents will wear a mask because there are children who are not able to be or not eligible to be vaccinated should as well. The other thing I was going to mention, just as Dr. Robinson and Dr. Mudd touched on, besides the social distancing and masking, is just really encouraging outdoor activities this summer, as they did last summer. So being outside where it is still safer, and being in gatherings where if family members and friends, older kids are vaccinated, that's going to help our children who are younger than 12 who cannot be vaccinated.
Great. Can we talk a little bit about the Delta variant? And do we know anything about whether it affects children differently than some of the other variants that are more prevalent in our community? Well, from my experience, at least from what I've been reading, you know, we are seeing cases rise. I haven't seen a lot of data on infections in children, to be honest. I think that as we go through this year, we'll learn more about that. In which situation we'll probably be able to see some data from the CDC and recommendations around how to prevent as well. We've talked a little bit about coronavirus infection in children as well. We have some data around that. Any of our panelists like to comment a little bit on coronavirus infection in kids and how that might be different than adults, or what long-term effects to expect?
One of the things, just speaking on the Delta virus, that I've been reading also is that for everyone, it's in general been a more serious infection with more complication rates. So I think it's safe to assume that it's going to be the same for children once we get data back, as you know, as we're living through this now and looking back on it in a year from now. I think we'll be able to have some better answers about that. And then the other question just left my head.
Just about coronavirus infections in children in general.
Okay. Although the advertising or the billing was that they were all mild and self-limited and nothing to be worried about, except for, as you know, at risk to older parents or family members, there are some children who've had severe infections, some complications. And one of the things that we don't have a good answer to is who is that person who's going to get that severe infection. It doesn't always make sense that the people that we might think have risk factors are going to be the ones who are more severely infected. In children, I think we always are just more concerned about infection. So children under 3 especially, we are a little bit more vigilant about diagnosing, not necessarily diagnosing, but treating them and monitoring them, because we don't know how this virus is going to affect them. And it can be unpredictable. So I don't think there's any room for us to kind of get comfortable and say that it's not a big deal in kids, you don't have to worry. I think we all have to be equally vigilant because we don't have the answers to all those questions.
Well, I don't see additional questions in the chat. Any final thoughts or comments from the panelists?
I guess I would like to end my contribution by telling how I have the conversation with parents about vaccines in general, and that is that we don't have all of the answers in medicine. There are a lot of risks in life, and one thing that we do know about the vaccines that we have and that are approved are that we know the risks associated with having them is considerably less. The risk of any adverse effect, the risk of any type of negative outcome is considerably less than the illness that we're protecting against, and that I wouldn't recommend anything for children that I wouldn't recommend for my own son. So I just like to give that vote of confidence, and hope that parents hear me.
I'd like to jump in as well and agree with Dr. Mudd. I feel very strongly about vaccines in general as a pediatrician. I feel it is one of mankind's greatest inventions, one of our greatest tools as a pediatrician. And I strongly recommend the COVID vaccine for all my patients 12 and older. I have 4 children of my own. My 16-year-old received his COVID vaccine in March, second dose in April. And then I have 2, a 12 and a 14-year-old boys who received their COVID vaccine within 3 days of being eligible. And then I do have an 11-year-old daughter who very much would like to get her COVID vaccine as well, because we've been talking about it for the past 15 months. And she also believes in the efficacy and the safety of vaccines, and also the COVID vaccine. Thank you.
And I will echo what Dr. Mudd and Dr. McIntyre said. Those sentiments are something that I hear myself saying at least weekly, at least once a week, if not more, that I care for my patients, and I recommend the same things for them that I would recommend for my child. I want us all to be as safe as we can. I want us all to continue to be vigilant, and don't let the fatigue take over. Think about being safe and keeping everyone else safe. It's not just you who you're keeping safe. Other people who are around you, people you don't even know. It's the butterfly effect. You don't know what that one butterfly wing, what the effect can be somewhere down the line. So if something that I'm doing, something that we're doing could keep someone safe who I don't even know, it's worth me doing that. It's worth all of us doing that in order to care for ourselves and to care for our community.
Absolutely. Well, thank you all for having us today. Thank you, Cuyahoga County Public Library, for giving us the opportunity to share our thoughts on the COVID vaccine. Again, thank you for having us. This has been a nice night to talk about our vaccines.